Hi, I'm Elisa Pauls, an occupational therapist.
And I'm Ashley Beheimer, a physical therapist. And we both specialize in the treatment of the pelvic floor. Problems that we see can include things like incontinence, which could be either urine leaking or bowel leaking. It could be feeling like you have to go to the bathroom really frequently. It could be pelvic pain or pain with sex. Could be low back pain, or it could be pelvic organ prolapse. We often see these issues arise around the time of childbirth, either during pregnancy or afterwards. It can even show up years later.
Today, we actually want to talk to you about the use of diaphragmatic breathing as a means of relaxing your pelvic floor to help you through labor and delivery process in hopes that we can prevent some of these issues from occurring.
There's a common myth out there that you need to strengthen your pelvic floor leading up to childbirth to push that baby out. But actually, your uterus is equipped with all the strength it needs to do all of that contracting and pushing. What you want to do instead is relax your pelvic floor and lengthen it to let that baby pass easier and with less trauma.
To encourage that relaxation of the pelvic floor during laboring and delivering, we want to show you how to do that today through diaphragmatic breathing. So if you put a hand on your belly and your chest, that'll give you some feedback as to whether you're doing it correctly or not. So we want all of the breathing to happen down in the belly. Your diaphragm is located down in your belly. That's where we want it to occur. An example of a way not to do this is to use your chest and your shoulders, which might look like that. So instead, what we want to see you do is to breathe through the belly. So all of that expansion and deflation should come from your belly instead, and it would look something like this. Sometimes you might even find it helpful to use timing to help you further relax and focus on your breathing. So if you focus on breathing in for 3, and out for 6. This would be a good thing for you to practice in preparation while you're pregnant or for preparation for labor and delivery.
We also want to talk to you about various positions you could consider for childbirth. We've all seen the standard one of a woman on her back with her knees bent trying to birth a baby. But there's a lot of other different options that could maybe even be better than that, and that could help you relax that pelvic floor. It all depends on what feels best to you and what's helping that baby engage. Your OB nurse can help you trial different things to see what does feel the best or what's helping that baby progress the best.
We hope that you've learned something about your pelvic floor today and maybe some tips and tricks that can either help you deal with some of the issues you might have or to prevent them from happening in the future.